Assalamualaikum sir. Good afternoon. Let me introduce myself, Nurse Anggia, who is on duty from 7 to 2 p.m. I will do a heart and lung examination on you. Are you willing? So, before taking action, we prepare the tools first. The tools we need are a stethoscope, clean handscoon, and hand swab. The first action we take is washing our hands before contact with the patient and the patient environment using the sick correct and washing step, namely palms, back of hand, between finger, thumbs, looking, and fingertips after they use clean handscoon. Next, we do a physical examination of the heart and lung. The first is inspection. Look for trauma or retraction on the chest wall and upright ictus cordis and pulse in the upper case ICS2. Second, palpation. Aims to determine whether there is pressure pain or not and ask the patient whether they feel pain when pressed. Then, check the height of the left and right lungs symmetrically by placing both thumbs on the patient's sternum. Telling the patient to take a deep breath, and we pay attention when the patient inhales whether there is a difference in height in our thumbs to determine whether there is fluid or not in the patient lungs. We instruction the patient to say 777, will the nurse place both palms on the chest alternately. If there is difference in vibrating sound when the patient says 777, then it is suspect there is fluid in on one the lungs fills. Let's say 777 sir.
777 777 777 777.
The next examination is percussion. This action aims to determine the boundaries of the body's organ in the chest, such as the heart and the lungs and the liver, and so on. To determine the boundaries between the lungs and the liver and heart, we tap the patient's chest using one finger as in the videos. Then to determine the boundaries between the heart and the lungs, we tap the patient's left chest in the mid-clavicular ICS2 to ICS5. Next, auscultation aims to listen to lungs feel sound, whether they are left or right vesicular or whether there are additional breath sound such as ronchi or wheezing. By telling the patient to breathe normally, and we listen using stethoscope to see whether there are additional breath sound or not. Continue to cardiac auscultation, aimed at listening for normal or abnormal heart rhythms using a stethoscope in ICS4. That is the technique for physical examination of the heart and the lungs. Thank you for watching. Bye.